Welcome to the office. How's it going?
Good.
Samuel, welcome to the office.
Thank you.
Dad, why are we here?
So
What's
we're
going on?
here just to give him a checkup. He's been limping
Okay.
and having pain here and there.
For
I think
how long?
He's been having this for quite some time now.
5 years?
About
Samuel, you're
6 to
16
5
years old, right?
Yeah.
16 years old. And when we went to take the x-rays, you were saying that this started as a lump on the side.
Correct.
And there was no pain there. And that happened, what, 8 years ago? He was 8 years old? 10 years old?
I believe this was in 2000, like I want to say like in the beginning of 2015.
Oh.
Yeah.
We're in 2024, dude. Okay, all right, so
Yeah.
that's when that thing kind of started.
Exactly.
All right, and when we took the x-ray, we noticed there's some foundational issues going on. And this is what started this process, and this is why I wanted to kind of have some sort of documentation, video documentation, so we can look back at this down the road, okay? Now, 2015, so that was 9 years ago, you're 16, so 7 years old.
Yeah.
7 years old is when you noticed it. But the pain started when?
Probably like in the beginning. Yeah, like when I was playing soccer, the beginning when we noticed is like just like out of nowhere, I had just like woke up from my bed and I couldn't walk, and it just started from there.
The next morning.
Yeah.
And the day before you had a game?
I'm not too sure, but I'm pretty sure I did.
Okay.
But it was around the time I was playing soccer.
Okay.
So that's the process when we started looking for doctors, and then
You've seen who have you seen for this?
That was my wife. She was the one taking care of this.
What's hurting the most today?
probably my back,
Low back,
Yeah.
tailbone, mid back, where?
like low back.
Can you stand up, turn around and show me, please? And what you can see with him, he has an anterior pelvic tilt. There's no curvature here, there's swelling here, and the spine kind of goes like this. This is all compensation to whatever's happening here, and we're going to evaluate it on the x-ray. Where is your pain right now, the majority of it?
Majority, I would say like right here.
And you feel it right now?
Not standing, no.
Sitting, you feel it more?
I would feel it sitting or walking.
Walking. Okay, well, let's see you walk then. Stand over here, please. Let's walk to the corner of the room and back a few times. So you can see that left side doesn't move at all. He shifts.
Yes.
We call it the West Covina shuffle. You've watched. You know what? You know how. Hopefully, you know how I am. Okay. All right. Keep walking. So he doesn't actually plant his feet. He just kind of goes like this when he walks, right? He does this.
And I believe it's to avoid the pain.
Okay. On your feet or your back?
It's on my feet. I mean, not on my back, sorry.
All here.
Yeah.
Okay. Have a seat, please. What else do I need to know about you?
Activity-wise
right now, school, I know you're in summer right now. You study? He's a study guy?
Oh, yeah.
Yeah? So we'll have a few recommendations in terms of how he should be studying, sitting, ergonomics, basic exercises you will start today, really basic, just to get moving again.
Yeah.
Do you have access to a pool?
I do.
Okay. Swimming is probably the best thing he can be doing right now for movement. Now with what I'm going to do, Samuel, it may be a little spicy, tiny bit spicy. You know what I mean by that? You've had a chili before? Have you ever bitten into a chili?
Yeah.
A jalapeno or something?
Yeah.
It's just a little bite for a second, then it goes away.
Yeah.
Well, they say I'm kind of like that sometimes. Okay, so hopefully it'll be a mild peppercino. Hopefully, okay. All right, so we're going to go over your x-rays. After we go over your x-rays, we'll examine you, examine spine. I do need to work on your feet. I already see that.
Yeah.
And whatever else we find along the way.
Okay.
Do you have any questions?
No.
Okay, you ready to get started?
Yeah.
Let's do it. Booyah. Okay. All right. Samuel, this is you. This is a picture in time. It tells me how you've evolved from birth. We have 24 bones in the spine that move, 23 discs in between. This is your 24-story building. This is the foundation of your 24-story building. In order to have a stable building, we need a level base and foundation. And you're complaining all across here, but you can see the imbalance, right?
Yeah.
Okay. And we're going to get to that in a second. I want to get over here and show you kind of what's going on first on this x-ray. And on this x-ray, what we're looking at are the curves, the discs, and the posture. And the first good news I'm going to give you, he has a perfect textbook neck curve. Okay, that's the best news so far. He's adapted very well to his situation. If we run a line, a posture line from here up, okay, we can see on the posture line, we're looking at, do the hips, shoulder, and ear line up? Remember I said stand up nice and tall.
Yeah.
So that's how they should line up, Dad. And when we look at it, it's not bad, but it is slightly behind. The upper part of the building is slightly behind the foundation. So these muscles have to work a little overtime to hold them. So I know you also get some tension across here probably when you're sitting a long time.
Yeah.
Make sense? Yep. Okay. Disc-wise, let's zoom in and then we'll get to the foundation. Now in your case, I'm going to start top down. So this curve is great, okay? I'm happy with the curve. The discs are good in there. The bones are good. These discs are all good, level and parallel. Great. You can see a little kinking going on in here. I'm going to change the factors a little bit so we can see a little bit better. And this is all kind of binding because of that curve on the other x-ray. Let's go down into the tailbone now, and let's change the factors. And hopefully you can see what I'm showing you. And I'm going to show you on the spine model. The sacrum, or the tailbone, guys, are 5 individual segments. Okay, so you can see those nerves. Those are sacral nerves. There's 5 pairs, right?
Yeah.
Then there's the tailbone, the tailbone and the coccyx. Some people will say this whole thing is the tailbone.
Yeah.
The sacrum are 5 individual bones that mature at about the age of 32. Okay? They are individual right now in him. They can misalign, cause pressure. Okay. Now, when I'm looking at the tailbone, I'm looking at that smooth arc, number 1. I'm also looking at these, look, these disc spaces. You see, they're individual. But look what happened there. It's open in the back, S1. So that's one injury we're going to look at. I know it's there. S1 is one of them. Okay, now we're going to go down a little bit further, and I had to really change these factors to see this because it's a little, there it is. So this is S1, S2, S3, S4, S5. Now in the coccyx, we also have it's a little hard to see, I know, but there's a little tiny bend. This is sticking out just a tiny bit. So it's come, this piece right here, this top part just came back a little bit. Okay. So I got to push that one forward, number 1, and then we got to push that one forward. So there's 2 parts of his tailbone. That's 2 injuries. I'm going to keep going. There's more. Wow. You can see it now, the tailbone. That one's good, that one's good, that one's open in the back, and that one is tiny bit open in the back. Now, from here, I can also see this. This is an S1 base posterior sacrum. If we look at the back here of 5, this is the back of 5, the bone. This is the back of the sacrum. So the sacrum, S1, has come back that way. Now let's go to the other x-ray and show you how this all comes together now. Let's look at his foundation. So the first question, Samuel, do you have a level base and foundation? No. We have a lowered leg on the left side, 15 MD, 15 millimeter difference. This needs to be under 7 millimeters, Dad, for anything to hold. He's double. Now, he has a slight rotation of the tailbone sacrum on the left, that's the S1. And it's dropped 7 millimeters on the left side. Follow me, and here's your answer. PI14EX5. This is what's going on here. So his left SI joint pelvis goes down 14, out 5. That's a different injury. Okay, he's had at least 4 major injuries in soccer. Watch. This goes down, out. The tailbone goes back, and then it drops down like this. And then the whole thing goes down 15. You follow me? Now, if we are able to correct his pelvis, 15 will become 7. And the other 7 came from there. This is a tailbone injury, foundational injuries that caused his issues. This is not, he was born with it. Okay? So 7 of it comes from the tailbone, the other 7 comes from, or 8 comes from the pelvis. So that's what we have to figure out. Now, the book says if we have a rotated sacrum on the side of a rotated pelvis, PIEX, the pelvis should be adjusted first. In his case, I may actually work way down low first with the pelvis. Okay? That's where I'm at. Now, as a result of this, you can clearly see this drop is what created this kink. You see that, Samuel?
Yeah.
Yep. Okay. And now all of this is just compensating. The good news, the body hasn't fully compensated, and I'm going to show you with this line here. If we run this line from S1 up, if this line would match right there on the dens of C2, right there, if the line went here, that means the body has already fully compensated. There's nothing I can do to change the appearance. However, in his case, we can see that the body has not. All of this is compensating. You can see it from that. It's pretty clear. Yes?
Yeah.
All right, well, that's just an X-ray. You ready to get started? Yeah?
One more thing, Dad mentioned that he doesn't have an appetite.
Oh, no appetite? You not hungry?
Oh, yeah.
You eat?
Not a lot.
Not a lot?
No.
Why? You get full or it hurts?
I get full. Or I feel like I'm full.
Well, let's talk about his digestion then. Thanks for reminding me, because you full of poo-poo all here. Look at all that, dude. You got like all these little snakes in here, dude. You got all, that's all poo-poo in there ready, waiting to come out. Now, I talk about this in a lot of my videos, Dad. This is called a Meganblasi. This is the gastric air bubble. This is the correct shape, but it is 1/3 the size of what it should be. He's too young to have that, which means the digestion is off. In his case, we're looking at it neurologically, either from here or up here. So he will tell us, and I have had lots of patients say after an adjustment, they did the biggest poop ever. It does happen, okay? So let Dad know.
Okay.
Okay, just let Dad know. Or Mom. Okay, questions on the foundation?
No.
Are we clear, Dad?
Yes.
We're clear?
Makes sense.
Okay. It's basic mechanics, okay? It's basic mechanics. Now, again, this is how I see it. This is how we've been working with cases like this for over 20 years. And if there's no fracture, there's no pathology, there's none of that stuff. And you've already ruled all that stuff out. That's the blessing. He's had his brain checked. He's got no loose screws in the cabeza. No? Okay. Let's get started, guys. You know, Dr. Gonstead used to say, show the other man what you see. And keep explaining. That's why I do this, guys. You know, it's like you got to keep explaining it until they get it. And it's not that you say yes just to shut me up. Okay. Sit up straight. I get people, they're like, he talks so much and then he just cracks the same thing for everything, guys. But I will address that comment real quick, because this is also important, and I think Samuel needs to hear this too. Samuel, this is your spine, right? All of us have this, we said. Now, you into computers at all?
Yeah.
Yeah? You guys have a switch, you know, and a network at the house with wires running around and stuff like that, right? So here's what how I want you to think of this. This is the brain sits here on the skull. 24 bones, 33 pairs of spinal nerves that exit out. This is the power. to all the organs in the body. This is the power to all the muscles and joints in the body. When there is a kink or a misalignment pinching that nerve, there's less function. So pain is one of the symptoms that can occur. Okay? What I'm going to do now is I'm going to run a meter on your back. Have you watched any of my videos?
No.
Okay. So I'm running this little, it's not going to hurt, just feels, it may tickle a little bit. What I'm checking for is this. So I'm running a meter down your back. When there's a pinch on the nerve, okay, when there's a pinch there, it's going to register as heat on the meter. And that's going to tell me where the problem is, okay? Dad, you can come on my left side so you can see what I'm doing, okay? And his homework is very simple. 10,000 steps a day, walking or hiking, swimming. Be a kid, dude. Head down, please. Right there. And the first thing we're going to get is 15 points up top. 22 points. C1 occiput left side. And what we're going to see is interesting. You see how that needle stays the whole down, left side the whole way down? This is cord pressure actually coming from up top. And then it comes back at the bottom and goes to the right. This is classic cord pressure coming from the upper cervical. So now I'm going to add another injury to this. Now, because of the needle sticking like this, right, we're going to focus on the upper cervical today and down here. We don't need to mess with this today, okay? Next thing we're going to do, static palpation. Head down. And Dad, you can come over here on this side. Head down, please. Static palpation. So what we can see all these bones here. There's a little depression there, right? Then we see it there. And I'm just running. Everything feels okay right now, right?
Yeah,
okay.
until there.
Until there. And all of this is the body, that's all swelling and edema. That's inflammation. Okay, excuse me. Let's feel what's going on here. Okay, come back slowly towards me. That's 5. Pain?
Yeah.
S1, pain?
Not really, no.
S2?
Yeah.
S3? Yes.
Yeah.
S4?
Yeah.
S5?
Not really, no.
Okay, I'm going to be on the outside down low, okay? So his tailbone is there. On the right or on the left?
I would say the left.
Right there.
Yeah.
Right there. Left side, coccyx. Come back slowly. L5 tender.
Yeah.
And S1.
Yeah.
And S1 is that rotation. Now the next thing we're going to check is the hip. You can see on the dimples here, the right side is higher, the left side is lower. That's consistent with what we saw on the x-ray. And this is closer to the sacrum, there's a bigger gap here. So that's the PIEX. Now I'm going to push on the sides of the dimples. More pain when I push on the right or the left?
The left.
The left. So we have either the PIEX or the sacrum. And we said the book tells us to do the pelvis. We're going to do a leg check to confirm that. And let's check up top. Sit back for me, please. All the way back. Scoot your butt back, please. Thank you. Head down. Head down. Look down. Last thing. 6, 3, 2. Tender there.
Yeah.
Now, more up here or more down here?
Down there.
C1. Okay. All right, stand up for me, please. And what I'm going to have you do, we're going to do the leg check. I'd like you to go face down on this side. Put your face in here. And I want your legs hanging off the edge over there. And we're doing a simple leg check. I will explain it, and then we'll start. So what we're looking at in the leg check, we know we have to adjust the left SI joint. Okay? And right now, just doing this, his feet don't come together. Everything is being blocked from that EX pelvis. You can see the left leg is lower, right? Left leg is lower than the right. When I bend the knees, if it stays longer or lower, then it's the pelvis. If it goes shorter than this leg, it's the sacrum. Okay? Bend the knees. Bring his knees together for me, Dad. Come over here. Hold them here. If it's too much, you tell us, Samuel. Hold him firm. Okay? Lower leg, bend, stays long. That's the pelvis. You see that?
Yeah.
Long, stays higher still. That's the pelvis. Okay. Come on up, Samuel. Showtime. Walk it off one more time, please. Take your time. Walk once over there and come back. So we have it before and after. Have a seat. Have a seat over here. Let's get started. He's got a very interesting angle. I'm going to have to bring my angle of C1 slightly S to I because of the C2, and there's no pressure at C2. Nice and easy there. Okay? You're doing good, Samuel. Bend. Now for him, I need to bring my elbow up. Relax that left ear down. Gotcha.
Oh.
That's it. That's it. That's the home run, Bubba. Just give it a second. Deep breathing. You good?
Yeah.
Deep breathing. And out. One more time. Deep breath in. And out. Stand up and walk. See if anything is different so far. One more time. Okay. Good?
Yeah.
All right. Now let's do, we're going to do the coccyx on the left. Okay. Actually, we need to do the pelvis. Let's do the pelvis first. Let's go right side down, head over here, facing the TV, please. Del lado derecho. Bueno. Listo? Ready? All right. Bottom leg straight. Top leg is bent. Slide your whole body forward, please. I got you from here, okay? Nice and easy there. Relax the leg. I will not drop you. Or guess what? I send everyone to Hawaii. Don't try to fall. PIX. We're going to start it here. PI 14, EX5. The major is PI, so we're going to do it as a push move. You okay there, brother?
Yeah.
You all right? Okay. And we just want to push it up. I got you. Gotcha. That's it. That's it. Take your time. You okay?
Yeah.
Okay, come on up. Push yourself up. Swing your legs down. Good, just breathe. Just breathe. Okay. Now go ahead and walk. Hold my hand for a second. March in place, knees up high. There you go, knees up high. Good, now just regular walking. Tell me if anything is different right now, Samuel. And if,
I don't know.
okay. You said there was more pain when you sat, right?
Yeah.
Okay, why don't we sit now and let's see if it's same or better or worse.
It feels good.
A little bit different?
Yeah.
Cool. You ready for more?
Yeah.
Okay. All right. Now, let's go on the gray table. Let's go over here, face down. Step on the black platform, face down. Boca abajo. Abajo.
Oh.
Sí. Okay. Slide up a little bit, a little more. There you go. Down a tiny bit, please. Right there. Dad, I'll need your help, please. You're going to have your hands lightly, fingers like this, because when I'm going to do more in the pelvis, I don't want this to pop out. Okay? And before we do that one, let's do a little bit of the coccyx. I was going to pull it, but I can't pull the coccyx on the same side as the pelvis, so I'm going to do the coccyx here first. And for the coccyx, we're going to use the drop board. Are you okay in that position right now? You're going to hear and feel that, okay? That's not your back breaking. Are you okay? Yeah. All right. You're doing good, brother. I'm on your underwear, and I'm down low. Right there. You got him, Pops?
Yeah.
Good. That's it. Got him. He's good.
Okay.
Good stuff. Alrighty. You're doing amazing, Samuel. Excuse me. Bring your feet together. Okay, relax. Now let's get a little more of that pelvis. Hold him. There you go. PI. I'm going to hold the right side down there, pushing this one. You okay, Samuel?
Yeah.
That's the home run. Gotcha. That's it. You did amazing. Sorry. Just wait for it, Samuel. Wait. Come off slowly. Hold my hand. That's where we're going to start. Walk it off. Walk 3 times back and forth, please. The more you get him walking, Dad, the better he's going to do. 10,000 steps a day is the goal, okay? Minimum. Keep walking, please. And he's had this for a long time, so he's going to have to, a lot of it is going to be on his habit changes now, okay? And the more he focuses on the movement and habit changes, the deeper I can go each time.
Okay.
All right? Anything different for you right now?
It feels more like I could walk better, kind of.
A little smoother?
Yeah.
Cool. And you'll see as he walks, because when we're done, I don't know if it's hot outside, but you're going to walk at least 15, 20 minutes before you head out.
Oh, perfect.
And you'll see. You'll see. He'll tell you. Have a seat right there. Good times. All right. Let's recheck. Let's see if anything has changed. There you go. And the first thing we want to check is the upper cervical. So we had 22 points. Is now clear. Claro. You see the difference now? It's not sticking the whole way down. Mm-hmm. 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 Beautiful. Clarissimo. All right. Now, you remember what it felt like, right?
Yeah.
Come back slowly towards me. That's 5.
Oh, wow. What?
Back. You remember that one?
Yeah.
I'm pushing. Come back. Bueno?
Yeah.
Bueno?
Yeah.
Sí. Cinco.
Down I could kind of feel.
Same or less?
Less though.
Okay. Good stuff. That's where we're going to start. Now, you get a buff and polish. Good stuff, Dad. Good stuff. Good stuff. Okay, we're going to break up scar tissue now. When it goes over normal tissue, it does nothing. When it goes over scar tissue, you're going to feel that tickly spice. You feel what I'm talking about?
Yeah.
Yeah. You swim?
I used to, yeah.
You know how to swim, right?
Yeah.
Yeah, get him in the pool. And it's hot, so you'll enjoy it. What I want you guys to do after this visit, moving forward now, any little change is change. So what I'm looking for is what's different, right? Not, oh, it's still. We know he has stuff.
Yeah.
What's different? Doesn't matter good or bad. Okay, on your back, boca arriba. We're going to work on your feet. Straighten out your legs for me, please. Relax the shoulder. Okay. Does that feel any different lying on your back right now?
Yeah.
Okay. Relax the foot. Relax the foot. There you go. Gotcha. All right, you're all set. Come on up. Walk it off one last time. Good. Nice. Good. Squeeze my hand. Squeeze. 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 Strong. Just tune up your hands. You game a lot?
Yeah.
Yeah. I can feel it
Oh,
in this.
used to.
I can feel it in this hand. Elbow. This side. What game you play?
I play a variety. I play Call of Duty, Fortnite, Rocket League, Minecraft.
All the OGs.
Yeah.
Cool. Squeeze. There you go. Squeeze. Tell him. Tell him.
Oh, like,
It's stronger.
yeah. I could feel it on this one a lot.
Yeah. He's all set.
Awesome.
Any questions for me?
No.
Welcome to the office.
Thank you.
You're welcome. Dad,
Thank you. Really appreciate you.
welcome to the office. So we got some answers. Now we just have to go to through a process. I'll see him 3 visits,
Okay.
4 days apart, 4 or 5 days apart. All right?
Okay.
All right, dude.
Thank you.
You're very welcome. He's smiling now a little bit. Good.